Well, a recent study from the American College of Emergency Physicians reports 87% of emergency room physicians report feeling more stressed since the start of the pandemic. Pat Bean reports on what it's been like for one IU Health emergency room doctor.
This past year has been trying for Dr. Drew Waters in many ways.
I think both professionally, due to the volume of sick people, was very stressful, but even more so is emotionally, spiritually, the stress was massive.
Waters says working in emergency medicine for 14 years has left him numb to a lot of things that would shock a normal person. But the pandemic continues to challenge him in new ways.
You may know there's a very good chance they're not going to survive, and you can't let their family in to see them. They can't have their grandkids there, and so to keep the family separated, knowing this could be the end, is also difficult. So there's an additional emotional, damage from that.
Monroe County recorded its first death in mid-April, and by the end of October had more than 3,500 cases and nearly 40 deaths. And that put more stress on an already strained healthcare system.
When you get admitted for COVID, you're not in the hospital for a day or two, like you might be for a broken bone. You often spend weeks and weeks in the ICU, which means there's not room for the next patient to get a bed.
So, at times, the hallways in the ER, which usually operate near full capacity, were lined with beds full of patients.
Thanksgiving hit, and then it all went south. That's when our numbers went up, and things got a lot busier here.
The post-holiday surge meant December was the deadliest in the county. Cases rose by 2,800 and deaths jumped by 42, more than the first 7 months of the pandemic combined. Waters says the staff leaned on each other as the crisis grew, and there was a great deal of support from the community. But, as happened nationally, COVID fatigue began to set in.
Eventually, support often wanes with the novelty, going away, and then just the day in, day out grind of just feeling like you're trying to prop up things is really a tough strain for everybody in healthcare.
1 year into the pandemic, cases, hospitalizations, and deaths are all declining, thanks in part to vaccines becoming more available and to people still following the CDC's preventative guidelines. But, having worked on the front lines and seeing firsthand the impact of COVID-19, Waters is frustrated by the people who have spent a year downplaying the virus.
This is not an infection that is a world-ending apocalypse infection. This is just a really bad infection that we need to treat seriously. And it has just unmasked and let us see just how woefully prepared we were systematically and professionally and socially to deal with this kind of an issue.
For Indiana Newsdesk, I'm Pat Bean.